While most survivors will recover with basic psychosocial support, some will experience persistent symptoms and problems in daily functioning that require you to assess her mental status and refer her to a mental health specialist. Follow these general principles. Some of the mental health conditions most commonly associated with intimate partner violence and sexual violence are depression, PTSD, suicide or self-harm, harmful use of alcohol and drugs, unexplained somatic complaints. Your assessment should include 3 activities. 1. Pay attention. Pay attention to the survivor's mental status, including her overall appearance. Is she taking care of her appearance? Behavior. Is she disturbed or upset? Facial expression and mood. Is she crying, anxious, or without expression at all? Body language. What does her posture suggest to you? Does she make eye contact? Speech. Is it fast or slow, or is she silent? And thoughts. Does she have recurring memories? 2. Ask questions. While taking her history, ask general questions about how she is feeling and what her emotions are. Use questions such as, how do you feel? Are you having any difficulties coping with daily life? And, how are your difficulties affecting your life, such as relationships with family and friends, or your work or studies? And 3. If necessary, refer the survivor to another healthcare provider. If your assessment identifies problems with mood, thoughts, or behavior, and the survivor is unable to function in her daily life, for example, she has problems getting out of bed, taking care of children, going to work, or doing housework, she may have more severe mental health problems. Refer the woman to someone who can conduct a more detailed mental health assessment. Pre-existing mental health conditions should be considered when making an assessment and planning care. Any community will have people with pre-existing mental health problems, such as depression or substance abuse. These could get worse or reoccur if someone experiences IPV or sexual violence. Women with mental health and substance abuse problems may be at greater risk of IPV and sexual violence, so survivors may be more likely to already have these problems. A woman may have a history of exposure to violence, such as sexual abuse in childhood, intimate partner violence, or war-related trauma. You should consider her history in your assessment and treatment planning.